ran away from home and was in abusive situations there, ended up in putting myself into foster care. From that point, began using substances to self-medicate, and that eventually became problematic for myself. I was injecting in public for a very long time, off the highways, in between rotaries. When I was living on the street, I was public injecting or injecting in bathrooms, dirty bathrooms all over the place.
I'm a drug addict. I'm in recovery now. Excuse me, this is very emotional for me. I've been homeless in Cambridge for 3 years. About 3 years. I've shot heroin and cocaine in every bathroom, public bathroom in Harvard Square, Central Square. I've shot heroin in the City Hall bathroom. I overdosed 5 times last year. I'm lucky to be alive. I overdosed in the 1369 bathroom.
I feel like they don't want to know what's going on in the city. They just want to shun all the addicts and just put them away in a closet and say, just shut the door on them. Because that's how I feel as a mother and a grandmother. I don't feel that the city cares about them.
In the addiction field, basically, if we only offer one thing, you know, stop using drugs, and if you use for the very addiction that you're trying to get treated for, a lot of times you get kicked out, and then you're right back on the street.
So I've personally lost at least 24 patients from overdose deaths over the past 10 years. It's been heartbreaking to go to wakes and funerals with family members of patients who've lost loved ones. And we're seeing complications of endocarditis, osteomyelitis, strokes, severe skin infections, all because patients are using drugs in unsafe situations, whether it's in bathrooms or alleyways, parked cars. They don't have access to safe syringes, sterile water. They're looking over their shoulder in case they're interrupted by the police, and because of that, they're doing this very unsafely. These overdoses are totally unnecessary.
And we need to think very carefully about innovative strategies, out of the box type strategies that may help to reduce the harm associated with drug use, particularly opioid drug use. We can't keep doing the same old because it's not working.
So I have studied the epidemiology of drug use for almost 20 years now, and our messages should be very much that we should be preventing drug use as much as we possibly can. But our messages should also be that we live in a compassionate society that recognizes that substance addiction is a disease, it is not a criminal offense, and recognizes that if one has a substance addiction, we will work with them to help them stop the addiction, and until such time, we will work with them to minimize the harms that they can bring upon themselves from that addiction. So to my mind, there's nothing inconsistent about that. It is simply a message of prevention first, coupled with compassion and pragmatic engagement.
I think this is really about ending that stigma of addiction and developing a public health response to the challenge of addiction, and really moving us far away from this criminalization mindset that has failed so terribly in our country.
And I'm a member of a growing number of current and former law enforcement officials who are standing up all over the country to talk about this. It's a medical condition, folks. Medical conditions are not a police problem. They're not something that we should talk about in terms of crime and punishment. They're public health issues.
Safe injection facilities have been demonstrated to be effective around the world. There are over 100 of them in 60 cities. The most prominent one is in Insight, just across our border in Vancouver, Canada, which has been active for over 20 years. They've been shown to decrease overdose deaths, decrease public injection, decrease crime, decrease HIV and hepatitis C acquisition, and interestingly enough, increase access to addiction care. So when patients go to a place where they're treated with respect and have a relationship with the organization, and they're more likely to seek addiction care.
We know that the supplies that they will be getting are clean. We know that there will be trained medical professionals on site who are available to respond to any acute medical needs, particularly overdoses. And that can be potentially life-saving for so many people, and we see that it's worked extremely well.
What we're doing is trying to keep them alive. We're creating a place where they can come in contact with trained professionals or paraprofessionals who are not only able to supervise them in the process of injection by observing it and being ready to intervene if death appears imminent, but also to, if they have a glimmer of desire to change their lifestyle, that's an occasion where they can engage with people.
I did wound care out in Arizona, and when you see somebody's abscesses when they're injecting in their femoral artery out of puddle water from the monsoons, I mean, that's like 23-year-olds who are losing their leg. Talking to people up in Vancouver, it's like we don't even see abscesses anymore. We had this uprising of police going against, our participants. In the end, I had police officers coming in and speaking to our program participants about what we can do to respect one another's space. Our worst adversaries become our strongest allies once we're able to engage them in conversation, open dialogue about why we run these programs.
I think whenever we're doing SIF research, we need to know some basics. Are people interested in using the facility? Would they be willing to use one? So I did a really small pilot study in Rhode Island. We interviewed 54 people, young adults who are using prescription opioids non-medically. 31 of those had reported injecting in the last 6 months. We very briefly told them about an SIF. We just said if there was a place where you could go, where you could inject your drugs without persecution and under the supervision of a nurse, would you be willing to use it? 80% said yes, and 100% of the people injecting daily said they'd be willing to use the facility.
If I had a place to go, a safe place to go, I would have.
I wish that supervised injection facilities or safe consumption spaces were available 20 years ago and 10 years ago for the people that I loved and cared about and still love and care about that are no longer here.
People who are addicted and injecting in the alleys and in the doorways, they have no access to any sort of health care. And Insight is part of a program to try and redress that, to bring people who are marginalized out of society, back into society, back into the light of healthcare.
In 2003, our research group was contracted to conduct an independent, arm's-length scientific evaluation of Insight, Vancouver's supervised injection facility. After 8 years of evaluation, there are now over 40 studies published in some of the world's leading medical and public health journals, including the New England Journal of Medicine, the Lancet, the British Medical Journal, and the American Journal of Public Health. These studies show conclusively that Insight has succeeded in fulfilling its objectives. It has been shown to reduce public disorder by reducing the number of people who are injecting in public places. It has also been shown to reduce HIV risk behavior, such as syringe sharing. As well, there has been a greater than 30% increase in the use of detoxification programs, and as well as increased uptake of other forms of addiction treatment. As well, in a study published in The Lancet in 2011, we showed that within 2 years of Insight opening, there was a 35% decline in overdose deaths in the area around Insight. We have also published a number of studies showing that the establishment of Insight did not lead to increases in crime, it did not make drug use patterns in the community worse, and nor has it prompted individuals to initiate injecting by making the conditions for injecting comfortable.
Here's what they say is, I'm giving you a chance. You get your ass over to Insight right now and get involved with that. The police know it makes sense. It makes their job easier. The local business associations in Chinatown and in Gastown, before we opened the site, they were like, no, let's not do it. It's going to have a honeypot effect. It's going to be drawing people and users to this area. And it hasn't done that. So in the end, they've actually come forward and said, you know what? This has worked. And I support it. So to simply bring people into a clean facility, to make a bond with them, to build trust with them, it does nothing but good. It reduces people's usage over time, it makes them use smarter, it makes them use safer, it makes them think about detox. It doesn't draw people to addiction. What it does is try and draw people out of addiction. So it actually makes sense in just about any community.
What is so wrong with providing a safe place in a supervised atmosphere for a person with a medical condition to inject, to seek resources, and to get the help they need. Thank you.
We need places where people can love and connect to us. We need opportunity to make change when we're ready for it, and we need hope to stay alive and people who care that our lives will continue. And we need a chance to be able to live.